Hello, my name is Jim Hulse. I'm a respiratory therapist, and I would like to share some information for you about preventing acquiring a really severe case of COVID-19. There we go. All right, this is me and my personal protective equipment. This is a capper that helps prevent me from inhaling COVID-19 when I work with people on ventilators. I'm a respiratory therapist, a respiratory therapy faculty member, and I have been treating patients on ventilators with COVID-19. I've also been providing aerosolized bronchodilators to patients with COVID-19. These are supposed to be the most dangerous sorts of activities that you can take in the hospital. So I have some personal strategies to try to help myself not to acquire COVID-19. I want to share some of them with you. You know, the state and federal governments have recommended using social and physical distance by keeping people 6 feet away from other people, wearing homemade mask, or if a hospital healthcare provider is to work with a patient, then they're supposed to wear an N95, or like this capper that I was wearing. Healthcare providers are supposed to avoid procedures that produce aerosols. Those are the ones that I'm actually involved in. And preferably COVID-19 positive patients are placed in a negative pressure room. So when you open the door to that room, it sucks air in. So the COVID-19 is not blowing out to the other healthcare providers. So yeah, the state and federal governments recommended that people can produce these homemade masks and wear them out in public. In the hospital, we use the N95 masks there that you can see, and we wear all this personal protective equipment. And so basically all of these recommendations are to place physical distance between people and the potential for coming in contact with COVID-19. But here's the thing, is the World Health Organization warns that there is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection. Well, that seems pretty serious to me. I mean, it makes me worry about the prospect of being able to develop a vaccine, although I have seen that out of Israel and places there is work on that. But what if they have trouble? Um, what if they have trouble creating this vaccine that everybody's looking forward to? That's what this video is about. So contact with COVID-19 may still occur. Even though we have all this physical distance between us, how long can we do this? And sometime or other that we may actually have the COVID-19 touch us. So there's room for a second line of defense against COVID-19 virus if contact does occur. And that's what this is about. There are actually a lot of things that you can do to reduce the chance of contracting a severe case of COVID-19. Here's a electron microscopic image of the virus. So what is your second line of defense? It's your immune system. And given the current situation, it makes sense that you should keep your immune system functioning very well. So your immune system includes white blood cells, leukocytes, and macrophages. So white blood cells or leukocytes and macrophages, they swallow or engulf foreign material such as bacteria and viruses in an effort to contain and destroy them. They are very important parts of your immune system. So we need to take care of these. Neutrophils, macrophages, monocytes, dendritic cells, osteoclasts, and eosinophils all consume foreign bacteria, protein, viruses by a process called phagocytosis. And phagocytosis is this consuming. It's a process by which a cell uses its plasma membrane to engulf a larger particle, say greater than 0.5 micrometers. So your neutrophils, macrophages, monocytes, dendritic cells, all of those, they do something, this phagocytosis starts something called apoptosis, and it's the binding of nuclear receptors by viral infections and increases the intracellular concentration of free fatty acids and increase intracellular calcium concentration. So it can trigger this intracellular apoptotic signals. Anyway, it's a very, very structured way that your immune system takes a cell and identifies it as infected with, say, COVID-19, and then it has it dissolve in a way that dissolves the COVID-19 so it isn't spread out into the body. So it's a pretty important process. Now, there's something called the phagocytic index, and that's basically how effective are your phagocytic cells at swallowing and killing bacteria or viruses and these types of things. So it's how well do they do their job. And so we want to lower our risk of a serious case of COVID-19. So we need to determine what can we do that will affect how well our immune cells function. Is there anything that we can do that affects our immune cell function? And the answer is yes. The immune system is very complex and it's carefully regulated. So when we find studies, scientific studies that demonstrate an action that results in a significant change in how our immune system functions, we have found something that could change our susceptibility to developing a serious COVID-19 infection. So there's lots of studies that tell you what will help your immune system and what makes your immune system function less well. That's our second line of defense. So we got to pay attention. How do we keep our immune system very healthy? So one interesting, there's several interesting studies on the sugar intake on the phagocytic index. Look at this cake here. There's a lot of sugar in that cake. So high sugar intake decreases phagocytic index for as long as 5 hours. 5 hours. So the greatest effects are between 1 and 2 hours after eating the sugar, but the values were still significantly below fasting control levels 5 hours after feeding. This was one of the earliest studies on this, published in the American Journal of Clinical Nutrition, November 1973, but there's more recent studies. Here's one in 2017 called The Effects of Glycosylated Hemoglobin Levels on Neutrophilic Phagocytic Functions. And that's basically hemoglobin with sugar connected to it. And it says, thus our findings are generally supportive and provide evidence that chronic elevated sugar in the blood affects neutrophilic phagocytosis, which may affect our ability to fight infections. I was talking to an emergency room doctor about sugar and these studies, and he was going, oh, that's why diabetics have such high infection rates, because their blood sugar levels are so high. And that decreases how well your white blood cells, it decreases how well your immune system can function for a long period of time. Think about it. If you eat every 4 hours and you're having sugar every 4 hours, then you're just white blood cells are just always in a state of being depressed. I'm not just talking about eating carbohydrates. No, I'm talking about simple sugars, the ones that I've showed you, like in cake and candies. Those are the ones that I'm talking about. If you search the internet using COVID-19 and birthday party, you're going to find that these are called super spreading events, and they have played a significant role in the transmission of other recently emerged coronaviruses. So here's the deal about it. What do people eat at birthday party? Cake. They gather together close, they sing, and then they eat cake, which decreases their immune system. I'd be careful about that right now in this time that we're in, I'm not opposed to having parties and celebrating and eating great things. But right now, we're trying to keep from getting this problematic disease. And most of the people that are getting the bad cases of COVID-19 have underlying pre-existing conditions, and a lot of times these are pre-existing conditions caused by things like eating too much sugar and others. We're going to look at a number of other factors that can really depress your immune system. When you put these all together, you're talking about a second level of defense. Maybe it's the first level of defense from COVID-19, depending on how long this is really going to last and reemerge. I don't know, but I think it's important, whether we were even having COVID-19 or not, to think about what can we do to keep our immune system functioning at the highest level possible. So recommendation number one, do not alter your immune system function by eating sugary desserts. Do not. So again, do not alter your immune function by eating sugary desserts, all right?